Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. It is very important for us as pharmacists to document our clinical activities, our clinical interventions. When we do rounds, when we make suggestions for drug therapy, when we start or stop a drug, when we change a dose, clarify a route, change from IV to PO, provide drug information to our colleagues, or patient counseling to our patients, it's important that all of these activities are documented. If they're not documented, then to administration, it looks like it was never done. And why is it important in terms of clinical pharmacy services? If we want to continue and expand our pharmacy services, which over and over have been proven again in the literature to be valuable to an organization, improving patient care and saving money, then we need to document our interventions to prove our activities. Now, this has been a 40-year struggle, as far as I know, within the pharmacy profession. Ever since we started really focusing in on doing clinical activities, this idea of documenting those activities has been an issue. And today I want to talk about a recent article that was published in this year, 2021, and it talks about documenting pharmacist interventions. So let me bring up my screen and I will share my PowerPoint here. And I'll go back to an article that I wrote in 2003. I've talked about this article before when we started the Journal Club series on this channel. And just to review, as I wrote this article, I did research and I looked back 20 years on different methods that pharmacies were using for documenting their clinical interventions. And I found that they were doing it on paper. They were using PC networks, which were new at the time, their pharmacy information system or their electronic medical record systems, and personal digital assistants and other methods. And this was back in 2003. And I talked about a program that we created at our institution for a multi-hospital system. It was designed to be on the intranet for that institution. And the beauty of that program was that it was available to our pharmacists anywhere at any site, whether it was on an acute care floor or even in our clinics. And pharmacists were able to very quickly, within a minute or so, document an intervention and move on with their activities. And that was critical because I think the major constraint to documenting interventions is that the pharmacist has to stop, think, go to the computer, document. And if it takes a long time, then it's probably not going to get done. And so that was really one of the major goals when we created this program, was to make a quick intervention that could be completed in a minute or less. And if it was a longer intervention that required follow-up, then that should be able to be entered and completed within about a minute and a half or 2 minutes. And this worked out well for us, but what we found was not every intervention is being documented. So this has always been true for many years. So this year, there was a comparison of intermittent audit versus daily documentation of pharmacist interventions, and this was done at a site in Australia, but it applies to what we're doing here in America. And they looked at pharmacist interventions. They had two types. They call them process interventions, and these were the provision of drug information or patient counseling or reviewing a patient's profile and making therapy suggestions. And then they had drug therapy interventions, and those were the change dose, change route, IV to PO, start an antibiotic, stop an antibiotic. The drug therapy interventions specifically were classified as such. And then they did a comparison of a daily documentation. So just as we were doing at my institution, where basically we told the pharmacist, during your shift, any shift, go ahead and as you do your interventions, go ahead and document those. And then to compare it, they did audit days. So in other words, they picked days of the week, and they did this over time, so that they picked Monday through Friday, a different day for each audit day. And they had the pharmacists specifically go and document their interventions. And the pharmacists were told that that was an audit day and that they needed to document everything that they were doing. So what they found was that with the daily documentation, where there was no focus and no pressure really to document, the number of documentations of their interventions was about 1/4 of what occurred with these audit days, where they had a focused audit of pharmacist interventions. And when the pharmacists knew that the audit was occurring, they tended to document their interventions 4 times as much as the daily documentation. Now, in this 2021 article, they also looked back for the previous 20 years. So that would take it back roughly to where I had written my article in 2003. And as I mentioned, I was looking back 20 years. So, just adding those up, that's about 40 years of focus on this issue of documenting pharmacist interventions. So it's still occurring. It's still something that we need to be aware of, and it's still something that is an opportunity for the pharmacy informaticist to maybe find a better way of doing this, maybe through data analytics or even applying artificial intelligence as we analyze our EHR data. There must be a better way, but the importance of clinical interventions and the documentation of pharmacist interventions is still something that we need to be aware of and continue to encourage. So this was a Journal Club article, very recent, and it points out another great opportunity for us to document what we do as pharmacists to prove our worth, our excellence in practice, the fact that we save lives every day that we work in our pharmacies, and then go to administration and see if we can expand our services and move forward with the profession. And in the end, have better patient outcomes because of pharmacist involvement. So I hope this discussion was interesting for you. And if so, please like the video and subscribe to my channel, and I'll thank you for that. And in the meantime, stay safe, stay healthy, look after the health of others, and I will continue to work on more episodes. And I do hope to see you next time. Take care.